Hello, and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. For those of you who don't know me, I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. We are a full service family practice clinic located in Altamont Springs, Florida. We're here to service all of your family needs from newborn to elderly. You name it, we see you. We take care of all of your healthcare needs. We can be reached at 321-306-6755. Our website is wellslegacyhealth.com, where you can go on and check out the services that we offer and also book an appointment with us. We are accepting insurances. Right now, there's certain ones that we're accepting. So give us a call if you would like to know if we're accepting your insurance. More to come. Also, you can find us every Wednesday on social media for Wellness Wednesday. We're on Instagram, we're on Facebook, of course, TikTok, and also YouTube. So if you have not gone over to YouTube and subscribed to our channel, please do so. Wells Legacy Health and Wellness. We're going to go ahead and get started. I was not here with you all last Wednesday, so we're making up for lost time. So wanted to just thank you again for being here. This month, we're going to be discussing various health topics, but I found something that was very interesting that I didn't know before, that there is something called Movember, which is a movement to raise awareness about men's health issues, including prostate cancer, testicular cancer, and men's mental health in men, such as depression. This campaign, it's a month long, and it's where men are encouraged to, one, grow mustaches to spark conversation around critical issues that are impacting our men. We're in the month of November. Last month, we celebrated October. We talked about breast cancer awareness, and we celebrated the warriors who were survivors of breast cancer and those who have dealt with breast cancer and lost their lives. And we continue to pray for them and keep them in our thoughts and just lift them up and continue to support. This month, I want to focus in on men, on the men. We talk a lot about women's health and a lot about things that are going on with women, but I do want to make sure that we are taking some time to talk about our men, our male counterparts. And so this month, we're going to be focusing more on that. We will throw in some additional topics here or there, but for the most part, our topic this month will be focusing in on men's health. What we're going to do is talk about tonight prostate cancer, testicular cancer, and depression and mental health in men. You know, I love to give some statistics, so we're going to talk about some of the statistics. When we think about Movember, which was something I did not know, what is it? Why is it important? Why was it initiated? Why was it started? Who started it? So Movember is a foundation that was established in 2003, and it was a global movement aimed at tackling men's health issues, focusing in on early detection, prevention, and raising awareness. Sound familiar? It's a lot of what we do with women and other health conditions. But Movember, spelled Movember, men's health, where we're focusing on all things men in the month of November. I know that several men have said, and I've seen it somewhere on social media, about no shave November, where in the month of November, they're not shaving, they're growing out their beards and they're growing out their mustaches. So I'm not sure if that's related to this or not, but it's kind of coincidental. So we're going to dive into it. So what's the significance of growing out the mustache? I was curious, so I had to go do some digging and some research. Growing a mustache is a conversation starter that encourages men to openly discuss their health. I've seen some funky mustaches here lately, and some that will definitely start conversations. And so it's important, one, that we highlight men's health, that we talk about it, that we focus on it, that we support men, that we educate. I can remember when I was in nursing school, part of my community assignment was to go into the community with a group of students. I was their assistant professor, right? But it was my clinical assignment. I worked with their clinical instructor, and she brought me in to help her and to assist them. And one of the things that we did was we went into many different communities, but primarily downtown, those areas that are around downtown, the Carver Court area, Paramore area, and provided education. We went into the salons, we went into the barber shops, and we provided education and health screening. And I feel like that is so important that we're bringing the health to these individuals. So we talked about the significance of the mustache. The goal of Movember emphasizes one, we talked about it earlier, early detection, better treatment options, and improved mental health resources to help men live healthier and longer lives. As we know, men, and not all men, I can just speak from experience from some of the men that I know. I have someone in my family right now who is dealing with some health issues and refuses to go to the doctor, refuses to go and find out what's going on. And if we can just get them to go and figure out what's going on, it may be something very simple, or it may be something that really needs some attention, but we won't know until that individual goes to the hospital. So I'm hoping and I'm praying that he does, because I don't want anything to happen to him. So prostate cancer. We already know kind of what prostate cancer is, but it's the one of the most common cancers in men, and it's second only to skin cancer in men. So very common. It occurs in 1 in 8 men will have a diagnosis or will receive a diagnosis of prostate cancer at some point during their lifetime. Some of the signs and symptoms of prostate cancer: in the early stages, there are no signs. Later stages, there may be some difficulty urinating, blood in the semen, pelvic discomfort, bone pain, and erectile dysfunction. As men age, just as with women, there are certain, well, not even as you age, but there's certain health screenings that should be completed or sought after, or that you need to have at different points or different milestones within your life. And prostate screening is one for men. And the screenings will look different depending on family history, your ethnicity, genetics, things of that nature, right? If you're having any symptoms. So we'll talk about that a little bit more. But some of the screenings, how do we screen for prostate cancer? The first one is a blood test. It's called the PSA. And what this does, it measures the prostate specific antigen or PSA levels within the blood. This blood test can be really finicky, right? Because if there's too strenuous of activity, or if the male has engaged in sexual activity at any point prior to a certain point of time prior to, the levels may be elevated. So it's very finicky when it comes to the test results of that one. But it can be pretty reliable as an indicator that something is going on, right? Anytime we get blood work and there's abnormal results, yes, as healthcare providers, we look at the results, but we also look at that patient. And so the results, along with the physical exam, will help us to determine if there's something going on. If the levels are elevated and we think that it's too high, or it's a false elevation, or the test may not be too, the results may not be too reliable, there are certain things that we will educate that patient on. So if you're going for a PSA level, make sure you're staying hydrated, right? Make sure that you're not doing any strenuous activity prior to, and you have not engaged in any sexual activity, I believe, within the last 24 hours or so, because if so, that could cause the levels to be elevated. And I may be wrong on that in terms of the time frame, but there is a time frame that they would like for you to refrain from any sexual activity before you have this test done, because it could cause false elevation in the blood work. The next thing is, as I mentioned, the physical exam, the digital rectal exam. This is a physical examination of the prostate. And a lot of men don't like this, but it's necessary. The exam is done by placing digits within the rectum and filling the prostate. That's really the only way that we can actually go in and feel the prostate and see if there's any abnormalities there. I can remember when I was in MP school, and we were doing our physical exam course, and we had to go through and actual feel and find out how many nodules we found on the prostate of our dummy patient, our male patient, our mannequin. And it was very interesting to try and find it and feel what normal was versus what was abnormal. And so healthcare providers have been trained, and it's a very professional procedure, and we try and make the patient as comfortable as possible. It doesn't last long, but it is definitely needed. There are some other testing that can be done, such as ultrasounds and things of that nature, if there's something abnormal or if the patient is having issues. But ultimately, PSA and the digital rectal exams are going to be the gold standard for determining if there's something going on with that prostate. Treatment options. So we have active surveillance. So what we'll do is, if there's elevation in the PSA, we'll do some additional labs to look for cancer cell, the CA125, and I'm sure there's some others that are specific to prostate cancer. But when we get to a point of someone actually having prostate cancer, usually at that point, they're going to be going over to see a oncologist, and that oncologist will begin to order more specific testing. But active surveillance is just monitoring the slow growing cancers, and prostate cancers can be slow growing, but you can have some more aggressive types. But if it's a slow growing type of cancer, then we'll just continue to monitor it, or the oncologist will begin to monitor it and treat the patient as needed. Surgery or radiation for more aggressive types of cancers of the prostate. And then hormone therapy and chemotherapy is another way to be another method that can be used for more advanced types of prostate cancer. Support and resources, and we'll kind of talk about each topic and then we'll kind of bring it together. But there's always benefit to having support services available for men, especially those who have prostate cancer. But Movement Foundation offers prostate cancer resources and support. There's the prostate cancer organizations. There's different support groups that are available. You just have to go online and Google and find out. Cancer.org is another way to find different types of resources when it comes to support groups based on the type of cancer an individual has. When it comes to understanding testicular cancer, one of the things that I learned about testicular cancer that just like blew me away when I was in nursing school was we had a male patient to come in, and when I was in NP school, we had a male patient to come in to get screened for drug testing. And for whatever reason, a pregnancy test was done on the sample and it was positive. And this individual ended up having testicular cancer, because with some testicular cancers, there's the HCG hormone, which is the pregnancy hormone, which shows up positive when an individual is pregnant, and it had those hormones in his system. And so based on that, he was sent for further testing. First, they thought it was an invalid sample, but it was his because it was retested. And it was determined that it was his, but he had testicular cancer. Testicular cancer is most common among young men between the ages of 15 and 35. 1 in 250 men will be diagnosed with testicular cancer in their lifetime. It is highly treatable if it's caught early. So early detection, preventative screenings can save an individual's life if we catch it early enough. So some of the symptoms of testicular cancer are lumps or swelling in the testicle, feeling of heaviness in the scrotum, pain, discomfort in the scrotum or testicles, a dull ache in the groin, or abdominal pain. When we're talking about this age group, the ages between 15 and 35, many of the younger individuals are not as open to talk about things that are happening with their bodies, but we have to make sure that we're talking to our young men about knowing what their bodies look like, knowing what normal is, know what it feels like, what it should look like. So that way, if there's anything abnormal, that they should come and tell their parents or tell someone or seek medical help, right? Try not to have them hide it or wait it out or talk to their friends about it and try and self-diagnose themselves. Or now, as we have TikTok and all the social media, go to social media or Google to try and figure out what's going on. Have that open dialogue with your kids and young adults about their body and their health. How do we find out? How do we screen for testicular cancer? So men are encouraged to perform monthly exams, ideally in a warm shower, to feel for any lumps or abnormalities of the testicles in the scrotum. So just as women should be doing their breast exam, men should be doing their self-testicular exams every month. And I'll drop some tips and things on the page or in the chat for individuals to come back and review later. Screening. What do we do for screening? Again, performing their monthly self-exams, their testicular exams in the shower, and then a medical exam. So if abnormalities are found, an ultrasound can be done, and then also blood tests can be done. And again, incidentally, if they give us a urine sample and it's tested for a pregnancy test is done, and if it shows up positive, that is one of the possible indicators for a positive diagnosis of testicular cancer. Just one, but there's many. Treatment options is an orchiectomy, and that's where the testicles are removed, and that's the first step in treatment. It might be just one or both, depending on the degree of the cancer and if it's advanced or what have you. Radiation and chemotherapy, if it's more advanced or if it has spread or if it's a higher risk type of cancer. So if it's a more aggressive cancer, then an individual will receive the orchiectomy, where they remove the testicles, and then they may also receive chemotherapy and or radiation. It just depends on the type of cancer, how advanced or how aggressive it is, and then the treatment plan that's designed by that oncologist that the patient is seeing and assigned to. When it comes to depression in men, and I feel like I'm kind of going fast through this because I want to make sure I get all the points out, but I don't want to lose the gravity of this, right? The brevity of this, because it's so important that our men take care of themselves. And it's so important as the women in their lives that we're holding them accountable and that we're helping them by helping them make the appointments or giving them the information or the gentle nudges to complete the testicular exams each month, the gentle nudges to schedule the exam to go get their prostate checked, all of those things. We can't take on the responsibility of their health. They have to do it for themselves. And so being there as support and as an encourager it means all the difference, or world of difference in their life. So when it comes to depression, roughly 6 million men in the United States experience depression annually. Men tend to hide their emotions. They don't, not all, right? It's not a blanket statement, but some men don't like to talk about their feelings. They have been taught from young boys or little boys that crying makes them weak. Showing your emotions make you weak, and that you have to be hard. And so a lot of times men will stuff their feelings down. They'll bury their head in work or, being busy or doing other things to take their minds off of what they're really feeling like. I'm so grateful now that we have a society where individuals are open to talking about their mental health and the importance of mental health and reaching out for help. I want to put this out there that the National Suicide Hotline is 988. That number is available 24 hours a day, 7 days a week, 365 days a year, and even 366 when we have the leap year. But just want to make sure that men know that there is help available for them. Men are 3 to 4 times more likely to die by suicide than women, underscoring the importance of mental health in men and the awareness of mental health in men. 3 to 4 times more likely to die by suicide than women. That's a lot of people. And if we can make a difference in one person's life, then I've done my job. If I could help get someone to get the services and get the help and get the counseling and therapy that they need, then I'm all here for it. And if you're watching this, or if you know someone that is dealing with either of these situations, or they need to talk with someone, or they need a physical exam, reach out to us. Let us get connected with them and make sure that they're getting the care that they deserve and that they need. Roughly 6 million in the United States, 6 million men. That's a lot. And 3 to 4 times more likely to die from suicide. I'm stuck on those numbers because they're astronomical. What are the signs and symptoms? Some of the common signs and symptoms of depression: persistent sadness, loss of interest, sleep problems, fatigue, and irritability. When we're doing our physical exams, we do something called a PHQ-2, which is a psychological exam that we use by asking 2 questions to screen for depression. In the last 2 weeks, have you experienced any sadness, hopeless, depression, or suicidal thoughts? Have you felt down, hopeless, or depressed? Have you lost interest in doing things that you normally like to do? Based on those answers that are provided, and it's asked every day, seldom, once, 3 times a week, or what have you. And based on that, we will then ask some additional questions. If that individual has a history of anxiety, depression, panic attacks, insomnia, we will ask these questions. And so it's important to be truthful and honest with your healthcare provider when you're being asked these questions. There's no shame, and shame on those who would shame someone who's dealing with depression. Signs unique to men, because we know there's a book that says, was it men are from Venus, women are from Venus, men are from Mars, or something like that. 2 different creatures, completely opposite. And so men tend to display anger, irritability, risk-taking behaviors, substance abuse. They begin to change in the way that they do things. And if they were usually someone who's very cautious, they're the complete opposite. It's very interesting to see a male patient who's going through depression and some of the behaviors that they may exhibit. So some of the screening options for depression is online tools and questionnaires that can help gauge the mental health. And that's something that individuals can go online and do, complete these questionnaires on their own. But also, if you're seeing your healthcare provider every year, you should be being screened for depression every year. And based on the outcome of those questions, there's something called the PHQ-9, which goes into deeper details, asking more specific questions about behaviors and patterns and things of that nature. And then based on that, these individuals can be referred to a psychiatrist or someone who can assist them with, if need be, medications or treatments or different type of cognitive therapies that can help with depression. Many times people just need to talk to someone to know that they're heard and to know that their feelings are valid and validated. Therapy. There is nothing wrong with going to therapy. And I'll say this: Jesus and therapy saved my life. Jesus, therapy, and Pelotons saved my life. And I'm such an advocate for therapy and having someone to talk to. So there's different types of therapies, as I mentioned, and there's one called cognitive behavioral therapy, which is CBT. And there's other forms of talk therapy, going and talking with someone. And I love that now, COVID created this culture of virtual, right? So we don't have to go and sit on someone's couch. We can sit on our couch and talk to a therapist. We can sit on our back porch and talk to a therapist. We can be at the park and talk to a therapist. We can be in our bed and talk to a therapist, right? The access that's available now, Hello Alma and some of the other Headspace and some of the other online platforms that allow ease of access for therapy options and schedules that are flexible, so that if you have to do it on your lunch break, or if you're someone that works a standard 8 to 5 or what have you, banker's hours, there's different options to choose from. Medications, antidepressants are often used alongside therapy. Lifestyle changes, exercising, healthy diet, stress management can also improve one's mental health. When it comes to support services. Movember Foundation provides education and support for testicular cancer, prostate cancer, as well as depression and mental health issues. When it comes to cancer, we have the American Cancer Society. That's a resource for individuals dealing with cancer. When it comes to depression, there's so many different resources that are available. We talked about the Movember Foundation. They offer mental health resources and support for men. The Mental Health America is the NA or NAMI provides hotline support groups and mental health services for not just men, but for everyone. And then the suicide prevention hotline, as I mentioned earlier, 988, 24 hours a day, 7 days a week for immediate help. What can we do when we're coming to a close? Taking action, what do we do? Movember reminds us that men's health issues need awareness and action, right? Not just women, but men as well. And that we're encouraging them to perform these self-checks, to get the screenings, to talk to someone if they're struggling in their mental health. We want to make sure that we, if we can, for those men who want to join the movement for Movember and growing the mustaches. I know many men are growing their beards out, No Shave November. But support the cause by also donating and sharing your Movember journey with hashtag Movember. And the other thing is check in on friends. Remind each other of how important you are and how important they are to you in your life and to each other. Check in on people, check in on your friends, check in on your family members, check in on your neighbors. We never know what people are dealing with and what people are going through. Many people are struggling and they don't know how to reach out for help. They don't know where to turn. They fear being shamed or ostracized or talked about or made fun of because they're reaching out for help. Many cultures see depression and anxiety as a sign of weakness and going to therapy as a sign of weakness and talking to someone as a sign of weakness. And that is so far from the truth. Reaching out is strength. Getting help is showing strength. And it only takes a second to reach out. You're not alone. There's someone there for you. And I want the men to know that we value you, we need you, and we want you to be healthy. And we're here to help you in that journey and to support you in the journey for your mental health and just your overall health as well. So as we continue in the month of November, and as we continue to bring awareness to Movember, for those of you who are the men that are watching, who are growing their mustaches, if you want to take pictures and share it on the page, we'd love to see it all, right? We're here for it. We're here for it. Anything that we can do to get the news out about men and men's health and provide resources for men, we need to do it. So if you're here and you're listening or you're watching this on demand later and you have resources, please send them to me at wellslegacyhealth.com, info@wellslegacy.com, wellslegacyhealth.com. Email them to me so that I can share. I'm gathering information so that I can have my little book or my book of resources that I can provide to my patients and people in my community and my family, because that's what it's all about. Our mission at Wells Legacy Health and Wellness is to ensure that our patients, our family, and our communities has the information and the knowledge that they need to make educated decisions about their health and to be able to advocate for themselves. That's what it's all about, making sure that we're taking care of each other, making sure that we're here and we're around to leave a legacy of good health or to create a legacy of good health for our family and our friends. That's what it's all about. Take care of yourselves. Take care of each other. Call a friend today. Let them know that you're thinking about them. This has been another amazing Wellness Wednesday. I am Dr. Latoya Wells. I'm signing off tonight, but I want you to know that you are valuable. Men, the man that's watching this tonight, you are valued. You are loved. You are needed. You're wanted. And we support you. and we salute you for your hard work. Stay safe and be well. Until the next time, this is Dr. Latoya Wells with Wells Legacy Health and Wellness. Have a good evening. Bye.